Your blood test results are hiding a silent medical crisis, and you are currently misreading every single warning sign. Instead of stressing over those bolded high and low markers, imagine deciphering your actual cellular health in seconds. We are tearing down the primary care gatekeeping to show you exactly how to map your hormones and organ function. Stop guessing if your body is falling apart and start decoding the chemical signals your blood is sending right now. Last method I am going to show you. It is the secret tool that elite longevity researchers use to catch health issues months, sometimes years, before they show up on a standard test. So grab a cup of water, pull up your latest report, and let us get to it. Most of us view our blood work as a binary pass or fail test. We scan the right side of the paper looking for those red H or L symbols, hoping to see everything within the reference range. But here's the problem with that approach. The reference range in most labs is actually just the average of the people who visited that lab in the last few years. If the average person in your city is becoming more inflamed, tired, and metabolic disordered, then that average is moving towards sickness. To truly understand your health, you need to stop looking at the lab's normal and start looking for your optimal. Let us start with the first, most fundamental win, your complete blood count. The complete blood count is the bedrock of your report. It covers your red blood cells, your white blood cells, and your platelets. Most people gloss over the white blood cell count because they think it only matters when they have a raging infection. That is a mistake. Take a look at your neutrophils and your lymphocytes. A 2021 study published in the Journal of Clinical Medicine showed that the ratio between these two cells is a massive predictor of your body's hidden inflammatory load. If your neutrophils are consistently high and your lymphocytes are low, your body is essentially running a low-grade fire in the background. It is not necessarily a flu or a virus. It is systemic stress. You can fix this by cleaning up your inflammatory triggers. Simple changes like cutting out ultra-processed seed oils or fixing your sleep hygiene can shift these markers back toward a balanced state within just 6 weeks. It is not just about avoiding a diagnosis. It is about clearing the path for your immune system to do its job. Okay, so that is the first step. But what if I told you there is a way to look deeper into your metabolism that most people miss? That brings us to our second point, the metabolic health tier. Most people look at their glucose and say, well, I am not diabetic, so I am fine. That is the wrong way to think. You want to look at your fasting insulin. If you did not get that ordered on your last test, you should ask for it. A healthy fasting insulin level should ideally be below 5. Many labs will tell you that a level of 12 or 15 is fine, but that is a disaster zone waiting to happen. When your insulin is climbing, it is the body's way of screaming that it has to work too hard to keep your blood sugar stable. I remember a client, let us call him Marcus, who came to me with a normal A1C of 5.2%. He felt exhausted after lunch every single day. When he finally requested a fasting insulin test, his levels were at 14. He was technically not diabetic, but he was metabolically exhausted. By shifting his carbohydrate intake to prioritize fiber and slowing down his insulin spikes, he dropped that level to 4.8 in 3 months. His afternoon crashes? Gone. He didn't just avoid diabetes, he reclaimed his energy. If you are finding this breakdown helpful and you want to take back control of your health data, hit subscribe. I drop deep dives like this every single week to help you decode the complexities of your own body, and I have something even more powerful coming up in the final section. Now, let us move to the big one. This is the one I have been saving for you. It is the secret weapon for longevity. We are talking about the ApoB test or a polypoprotein B. If you only ever learn one thing from your blood work, make it this. For decades, doctors have been obsessed with your LDL cholesterol or the so-called bad cholesterol. They look at your total LDL and decide if you are at risk. But here is the problem. LDL is just a measurement of the mass of cholesterol. It does not tell you the number of particles that are actually clogging your arteries. ApoB measures the actual count of those dangerous particles. Think of it like this. If cholesterol were a freight train, LDL is the weight of the cargo, but ApoB is the number of individual train cars. You can have a heavy load on one big car or a light load spread across 20 cars. Research from the journal Circulation has consistently shown that the total count of these particles is a much stronger predictor of heart disease than just the total mass. You want your ApoB levels to be as low as possible for long-term health. Most lab ranges are incredibly loose, often allowing levels up to 120. But if you talk to cardiologists who specialize in preventing heart disease rather than just treating it, they will tell you they want to see that number under 60 or even under 50. When you see that number on your report, don't just ask if it is in the range. Ask if it is in the optimal zone for your decade of life. Think about that. Once you see your blood work this way, you can never go back to looking at it like a simple list of numbers again. You start to see the biological trends. You start to see the early warning signs before they become clinical problems. You have the power to look at your health not as a series of events happening to you, but as a system you can optimize. By focusing on your immune ratio for inflammation, tracking your fasting insulin for metabolic stability, and measuring your ApoB for cardiovascular longevity, you have successfully moved from passive patient to active manager of your own biology. That is the shift that changes everything. You just saved yourself years of guessing and potentially caught things your doctor might have missed because they were only looking for disease. If you got value from this, please share it with one person who cares about their longevity. It is the best way to help others stop waiting for problems to appear. Subscribe so you don't miss the next deep dive into how you can hack your own health stats. We will be looking at hormonal balance next time. Stay healthy, stay curious, and keep digging into those numbers. They have a lot to tell you.